Well, good afternoon, everyone, and thanks for joining us at 4 o'clock in the afternoon on day two. Before we get started, I am supposed to give you a conflict slide. So I am the Chief Technology Officer at LCMC Health. I'm also the CEO at Sapphire Health. Just a little background about LCMC Health. LCMC Health, by volume, is actually the #1 market share provider of healthcare in the New Orleans area. We operate 9 hospitals as part of the system and about 75 clinics. Next, I'll let Leah introduce Sapphire Health.
Hi, good afternoon. I'm Leah Politz, Director of Business Development for Sapphire Health. So Sapphire Health was founded in 2015 to kind of address a very niche gap in the market. Sapphire Health was founded to do Epic technical managed services, and that's it. So if you think about Epic services, a lot of them kind of scope creep out into the app space or other areas. This is just Epic technical services. And 9 years later, short or long, depending on who you ask, but 9 short years later, we are now the leading provider in Epic cloud migrations.
All right, so just a little bit about how AWS and Sapphire collaborated on behalf of LCMC Health. So one of the reasons why LCMC Health chose AWS for its Epic workloads at the time that they were considering, and it was actually one of the highest performing hyperscalers. The other reason for it was the breadth of services that are available to actually take advantage of it. So one of the other things that happened back in 2020 at LCMC Health, we were hit by not one, but 2 cyber attacks. So the need to actually have a security solution was very high. And one of the things that LCMC embarked on was a cloud read-only solution of its Epic environment in AWS. And there's actually a press release that's available for you to read about it. So it was one of the first CRO environments to go up in AWS. And today, LCMC Health is embarking on putting alternate production in AWS as well. And I'll talk a little bit about what we're doing there. So in the presentation today, we're going to talk about 4 things. One is getting a foundation built. So that's one of the journeys that we had to embark on at LCMC Health. By the way, there's a few words that if I say, I think I get some extra points. One of them is journey, so I'll use that. I think I'm supposed to use AWS somewhere in the presentation, which I just did. And then third is optimization. And so we'll talk about how we optimize the environment so we can save costs and so forth. The foundation for building is well, I'll talk a little bit about the landing zone architecture. We'll talk about the actual migration and what that took, some of the code travelers that we had to worry about, and the ongoing management around it. I hope you can hear me, but because I can't really hear myself. So there are 4 workloads that we worry about when we're talking about Epic environments, moving it to a hyperscaler. The production, all the non-production, test dev, things like that, the training, the alternate production environment, as well as the cloud read-only. So in the case of LCMC Health, we were looking at 2 very specific workloads. One was a cloud read-only, which was a security play for us, and the other was an alternate production, and that was more about cost savings and optimization. And I'll go over each one in a little bit more detail from an architecture perspective. But before we go there, I want to talk about the landing zone. So we started working with hyperscalers, both AWS and Azure, the other hyperscaler, probably a number of years ago. But when we did, we started working kind of in ad hoc. We started building out resources, and then we were building other resources and kind of going through. And in fact, one of the stories that I tell is that in the early part of this, one of our engineers actually built out kind of a small Epic ODB environment, and he decided to do Gen I/O testing and spent about $80,000 in one day. And that's, by the way, that's bad in healthcare. So one of the things that we have to do is we have to make sure that we build a foundation with some guardrails, not only around cost management but compliance. Making sure that we have kind of policy as a service and everything else built around that. AWS launched a landing zone accelerator for healthcare last year. And what it allows us to do is build out a multi-account strategy that complies with HIPAA compliances and a lot of the other best practice from a foundation perspective, and make sure that we're building out a cloud environment that we can have all the tools necessary to make it secure and to build on it with additional workloads. So some of the components of this landing zone that we were able to leverage, the audit trails, cloud audit trails or AWS audit trails allows us to have a centralized audit of all the logging that we have within the environment. And that's an important part of making sure that we have confidence to be able to look and have, to be able to have a visibility into the entire environment overall. The other thing that was important in building this out was building it with some sort of cloud formation. Now, we talk about automation all the time, but the ability to actually not do just a step-by-step automation, but to look at the final end state and to build out that end state and have the automation build all of the tools and all of the environments in between. That's what we're really hoping for, and that's what we were able to do using some of the tools that were made available to us from AWS, as well as using Terraform. I want to talk a little bit about the Epic CRO environment, the cloud read-only environment. Now, this was an environment that we actually sort of, we talked about it. It's something that Epic actually, promotes for all of its customers because it is a security solution. But at LCMC, it actually took on a special meeting because, like I said, we had a couple of security incidents back in 2020. By the way, in 2020, when the pandemic started, there was some sort of press release or something that said all of the, the organizations that hack healthcare environments were going to get together and not do anything bad to us. And we're like, okay, well, we got attacked twice that year, so I don't think they held up their end of the bargain. Having said that, one of the difficult things that happens when you're attacked is you want to make sure that all of your critical data and your infrastructure is safeguarded. So as CTO, you bring those systems down until you can actually make sure that no one is in your environment. When we bring down our authentication infrastructure and everything else, we can't access our read-only environments, which is what users are used to accessing when you have maintenance or other reasons that you have to take prod down. With a cloud read-only, we can create an immutable, completely isolated, independent environment that we can leverage as a read-only for users while we bring the system down locally to deal with whatever security issue that we're dealing with. After we brought up our CRO environment, the act of activating it is a single script that we can activate in 10 seconds. Now, it actually takes a few minutes for it to take effect, but we sever the network connection that produces the mirroring from our production to the cloud read-only, and we actually open up the internet access component of it so that people can access that environment through the internet. Now, we did have to do a few changes to our networking infrastructure. We got more robust internet connection from all of our hospitals as a result of this. But none of our clinicians are complaining that we got more robust internet connectivity, by the way. And it was very inexpensive, far more inexpensive than we had expected. But some of the things that I want to emphasize here, if you see, so the tools that we're using, things like Guard Duty from Amazon, it has automatic threat detection built into it. So it's not just about having a read-only environment, but it's about leveraging all the tools that are available in AWS to make this environment robust and secure, giving us the confidence to leverage it. It's a huge difference telling clinicians that you have access to things like medication records and what have you while we're dealing with this security event versus telling them that you have to go to paper or you're down. So it was a big difference, game changer for us. Which gave us the confidence to look at what do we want to do in terms of leveraging that optimization that we talked about, and cost optimization specifically. Last year, LCMC was in the process of actually refreshing its entire Epic infrastructure and realized that we needed to spend about $8 million to refresh the alternate production environment in our secondary data center. Now, in New Orleans, you may have heard, we do face some natural disasters once in a while. Our primary data center has only been wiped out twice, not once, but twice in the last 15 years. So there's some DR that we need to worry about. It just so happened our primary data center was in one of our hospitals, and our alternate data center was 3 miles away in another hospital, both serviced by the same utility provider. So it's not an ideal scenario. So we needed to move that offsite. But beyond that, but I think one of the reasons why we always kind of struggle to use a hyperscaler like AWS, despite all the obvious advantages, is that it's easy for us to go and say, hey, can I have some capital dollars because we've got this refresh coming up? In fact, if you look at our intake forms, typically they're all about spending capital to save OpEx. We don't even have a form to say I want more OpEx so we can save on capital. So it's a little bit of a change in mindset. But what was interesting here is that it was such a large capital spend. When we forecasted out all of the OpEx spend that we would have with AWS to put alternate production in AWS, we were able to show a pretty significant 40% savings in doing that over 6 years. Now, I did have to spread it out a little longer to make that, but that's a huge savings that you don't need a form if it's a 40% savings. So we were able to embark on that activity. By the way, I spoke with Debbie Wang from AWS Marketing. And when I was talking to her about this presentation, she said, make it as short as possible. So I think she said that right after she saw me speak. So hopefully that's not a, but we are trying to make it short so that we can have you answer questions. But one of the things I do want to kind of go back and mention real quick, on the CRO thing, a lot of people ask me because in the press release, it talks about savings in cyber insurance. Now, there were some other things that happened over the last 2 years that have increased cyber insurance premiums for all healthcare providers and some things for just LCMC. However, what I can tell you is that having the CRO environment specifically to combat ransomware attacks had a positive impact, meaning a low reduction in our cyber insurance premiums to the effect that it pretty much paid for the entire CRO implementation and project. So in terms of going through this process, we had to go through we took kind of a iterative approach to this. We first dipped our toes in the water, it was AWS with CRO, and then once we got the positive feedback and we were able to manage an environment well, we decided to do the alternate production, and we're getting some outstanding value back. But the approach to this for alternate production took about 2 months, and for for CRO it took about 2 months. And for alternate production, we're looking at about a 6 months to 12-month implementation timeline that systematically went through an assessment, a design, a migration, and we're in the optimization process right now. And what I can tell you is that each time we go back and optimize, we're eking out additional performance, we're eking out additional cost savings, and we have no reason not to believe that as we go forward into the second, third, and fourth year, we'll continue to squeeze out additional optimization. Something we cannot do with on-premise hardware, with static infrastructure. So that's what we're really excited about. And the other thing that I talked about in terms of the automation, the key benefit there for us that we did use an automation, a CloudFormation tool that actually creates a CloudFormation templates that was written by AWS. It's under an NDA, so I don't think I can say the name for some reason. You would think they'd want everyone to know about it because it's an amazing tool that allows us to take the inputs, like the cloud specifications guide from Epic and the data flows, and automatically create the entire environment. It's an amazing tool. It was kind of a wow moment. It was like the first time you saw generative AI actually work. And so the power of that is amazing. And we're now actually using Terraform to do essentially the same thing. And when I'm talking with other CTOs and at other health systems, I talk about automation at this, with hyperscalers being a complete game changer compared to the automation we're used to on-prem using Ansible and things like that, which is really more about scripting step by step. This is more about designing the end state template and having it automate the environment, tear it down and go through, and allowing us to ensure that we stay within the confines of the policy that we've dictated. Now, speaking as CTO, I can tell you that for on-prem infrastructure, people always ask me, what are your policies? I spend probably about 20% of my time filling out compliance forms. And there's always, and whenever I'm filling out a compliance form, I say, yep, we're compliant because we have this X policy or this policy or that policy. And then they ask me, what is my compliance to that policy? And the reality is I don't really know. And I think every CTO that tells you an exact number is probably making it up, because I know I make it up when they ask me. However, in AWS, with the tool sets that we're using, I can actually tell you the exact compliance level. And that's a huge value that we get just by working in that environment. So the results, as I mentioned before, 40% reduction in alternate production costs. That's amazing. And here's the thing, it turns out it's actually true too. So when I first sent it over to the board, we kind of made some high level numbers, but we're actually taking out OpEx costs as well as the capital costs that we talked about. It's definitely 40%, and with the additional optimization, we are actually looking forward to far greater savings than what we had even expected. We have the increased scalability, which is obvious. We are actually in the midst of onboarding 2 additional hospitals as part of an acquisition. And one of the key things is that we needed to bring in additional capacity for our production environments. Not having to bring in additional capacity for our alternate production environment is a huge savings that we didn't even think about. But beyond the savings, the ability to spin that up, that scalability, is amazing for us. Also, new processors have come out since the beginning of this, when we planned the project. So as part of this, we're actually already planning on moving to the new processor architecture, which is giving us additional savings and additional optimization. Something that we wouldn't have been able to do before. So we're very excited about working in this environment overall. But one of the most important things about this is from our chief CMIO, our Chief Medical Information Officer, Damon Dietrich. One of his key things is that for patient care, we want to make sure to reduce the friction and make sure clinicians feel that they have the tools that they need. And one of the most significant complaints we always received in the past is that my system is too slow, or over time it gets slower. And that's something we couldn't really deal with. We're able to constantly adjust the environment to provide a level set of performance for our clinicians, something that is probably the most powerful thing that we can deliver to them. And that's what makes Damon really happy. So if Damon Dietrich, our CMIO, is happy, then I'm happy because everyone else is happy. So that is the most significant result that we could have got out of this, and we did get that. Thank you.
Thank you.